Fine lines, deep smile folds, and shrinking lips. It's all a part of aging. But a quick and easy treatment can turn back the clock and restore your youthful glow. We're talking about injectables.
Injectables are anything that we insert under the skin with a needle. And there are probably two classes of injectables we hear a lot about. There are the fillers, and then there are other agents that are muscle relaxing agents, such as Botox or Brevibloc or Myobloc. And they're very different categories, so I think it's important first to make that distinction.
Injectables vary in its material makeup. Fillers such as Juvederm and Restylane are made out of organic materials. These are things naturally found on the skin, such as hyaluronic acid and collagen-based structural proteins. Patients can expect these fillers to last 9 months up to a year.
Juvederm is very much like another substance called Restylane, which we also use. And these are fillers that we can place in locations that are intermediate level of the skin. They can be used to fill in some fine lines. They can be used to fill in a little bit of a deeper sort of crease as well. Very well tolerated. Excellent also for lips and lip augmentation and volume with a very natural type of result.
Volumizers are made up of other materials called lactic acid and hydroxyapatite, which is a calcium-based filler. These materials are not necessarily inherent to the skin, but are very compatible. Radiesse lasts around a year, and Sculptra tends to last up to 2 years.
Radiesse is one of these terrific fillers, and I use it to give someone sort of a non-surgical cheek lift. You can actually create more prominent shadowing and build up the cheek zones, the malar areas with this type of a filler, and it seems to work really well. You are kind of the ideal candidate for these newer approaches that we're using. Sculptra is one of the newer fillers out there. It is used to sort of create real fullness and roundness and sort of rejuvenate in very broad areas of the face. You can use it on the cheeks. Some people are using it in the forehead, and the effect is to create a very natural but even toning of the face. In general, the candidates for fillers range really from anyone, from young as maybe early 20s, well on up. I mean, we've injected people into their 80s if they really want to do that.